For many years, overactive bladder was treated by trying to block bladder contractions. The assumption was that the problem was excessive nerve signaling, so medications were designed to inhibit muscarinic receptors involved in bladder contraction. While that approach can reduce urgency, those same receptors are also found throughout the body, including the salivary glands, gastrointestinal tract, eyes, and brain, which explains the dry mouth, constipation, blurred vision, and cognitive side effects that so many patients experience. What changed our understanding is a deeper look at how the bladder is actually designed to function during the storage phase. The bladder must remain relaxed and compliant as it fills, and this process is actively regulated by beta-3 adrenergic receptors located in the detrusor smooth muscle. These receptors were identified as the dominant adrenergic receptor subtype in the human bladder, and their role is to promote smooth muscle relaxation during filling, not by blocking nerves, but by activating intracellular signaling pathways that reduce calcium availability within the muscle. When beta-3 receptors are stimulated, cyclic signaling pathways are increased, leading to controlled detrusor relaxation, improved bladder compliance, and increased functional capacity. Importantly, this occurs without impairing the normal ability of the bladder to contract when it is time to void. This is a fundamentally different therapeutic strategy from anti-muscarinic medications, but which blunt cholinergic signaling globally rather than supporting physiologic relaxation where it is needed. This distinction has important clinical implications. Because beta-3 receptors are concentrated in the bladder and are not widely expressed in the brain or gastrointestinal tract, beta-3 agonists avoid the anticholinergic burden that is especially problematic in older adults. They do not contribute to cognitive impairment, sedation, constipation, or dry mouth, making them a safer option for patients with polypharmacy, cognitive vulnerability, or intolerance to traditional therapies. This mechanism is equally relevant in women and men, including men with concomitant prostate-related urinary symptoms, because it addresses bladder storage rather than outlet obstruction. The significance of beta-3 agonists is not simply that they offer another medication choice, but that they represent a shift toward treating overactive bladder by restoring normal bladder physiology instead of suppressing neural pathways.